Hello, Assalamu alaikum, and good evening to everyone. I'm going to talk today about Down syndrome and the role of lactation consultant and pediatric dentist in addressing nutritional and oral hygiene challenges. I'm Dr. Padmini Chiyadu. I'm a pediatric dentist and a lactation consultant. So first, I would like to start my topic with the breast milk. The breast milk, it's just more than nutrition in the development of infants. Okay, so it does contain a lot of growth factors, living cells, vitamins, antibodies, enzymes, hormones. There's so much of biochemically, it is such a rich, complex nutritional element to give a good start to your baby. Okay, so breast milk is something which is breastfeeding, something very fundamental and very important beginning for the healthy growth of an infant. Okay, so breastfeeding for use is more than, it just provides comfort and stimulation of all baby senses. Okay, and it does offer many benefits to the both babies and their breastfeeding parents, and the babies with Down syndrome stand benefit as much as they are more than the babies without this condition, because it offers quite good number, a good amount of protection, and which I will be discussing in my next slides. It's a feeling of empowerment. First and foremost, when you feed you, when the breastfeeding is something, it just empowers the parents and makes them feel so good about their baby, and it's a feeling of empowerment, and it has so many growth factors and enzymes which are very important for the development of healthy stomach. Okay, so breast milk is more easily digestible than formula, making it's very helpful for the babies with Down syndrome who often have a gastrointestinal issues. So this will definitely reduce the impact of any gastrointestinal issues, and will give a very good start to the life. And it has an improved immunity, as we discussed. It does contain a lot of immune boosting properties, so which are very important in preventing ear and respiratory infections, which are very common among these babies. And physical contact, the breastfeeding brings you into close contact with your infant, and this close connection is very good for the physical as well as emotional development of your baby. And as I said, it's the reinforced bonding, and it does strengthen your facial muscles. So breastfeeding, it does strengthen the facial muscles and the teeth. So it will help in the overall development of the growth of the jaws and also the speech as well. So as I said, it does contain a lot of antibacterial components, and among which lactoferrin is very most So this is very important, because it does entrap the bacteria which cause most of the time the stomach issues in infant, especially E. coli. So this is the reason why the breastfed babies have a very less stomach related infections, less stomach related issues compared to the bottle fed babies. And this bacteria is very important in preventing cavities, because this bacteria kills something like Streptococcus mutans. It's a bacteria which is responsible for initiation of the dental caries in children. And biomechanically, when the breastfeeding, and the phenomena, so the milk is directly dribbled into the food pipe. Okay, so what happens? There is no pooling of the milk around the teeth, so the breastfed children are very less prone for dental caries. And as we discussed, it is very important. It plays a very important role in prevention of ear infections. As we said, because of the constant suckling, mechanical drainage of mechanical milk, suckling of the milk, it just drains out the excess ear fluids also, which are responsible for less ear infections in breastfed babies compared to the bottle-fed babies. And very importantly, it does contain dexoxonic acid, which is called DHA, which is very important for brain development, eye development, central nervous system development. So it does contain a lot of benefits, and it offers a great start to the baby. Okay, and these are the foods which are rich in DHA. fish, flax seeds, and soy walnuts. So all breastfeeding mothers should eat this, should include them in their diet for the optimum production of DHA in their breast milk. So having known the important factors about the breastfeeding and breast milk, so what are the concerning issues in Down syndrome babies we usually face, and how do we overcome those issues? Usually they have a low, babies, the Down syndrome have a low muscle tone. So the muscles of lips, tongue, and face are toned and strengthened by the breastfeeding process. So because of this low tone, sometimes there will be a latching problem. So there will be sometimes delay in latching also. So, but still with the proper holding positions, with proper assistance, we can definitely directly initiate direct breastfeeding. And by doing so, we'll be strengthening the facial muscles, and which is very, very important for the speech and the growth of the dental arches. And one more issue what we face is strong tongue thrust, that they tend to push their tongue forward, which is usually causes latching issues also. And they're bits and sleepy babies also. So these are the issues. So excessive sleepiness, as we discussed, very sleepy in the first weeks after the birth, which can hinder the feeding. Okay, to establish the milk supply, ensure the infant is receiving enough milk, it may be necessary to wake him every 2 hours, at least 8 to 12 times a day. So the number of feed should be longer, number of feed should be more for every 2 hours. It can be also challenging to keep the infant awake for the entire duration of the feeding. The hind milk obtained in the later part of the feeding is higher in fat and calories, which are very, very important for the growth of the baby. So we need to keep the baby awake throughout the feeding period, because the baby has to receive the last portion of the milk, which is called hind milk, which is more nutritious, contains more nutrition. Okay, so how do we address these challenges? How do we make sure that we are providing the adequate? So first, dim the room light, stimulate the infant senses by lightly touching the edge of the outer ear, stroking his arms, and talking to him during the feeding. These are the ways we can keep the baby awake. And breast compressions also. Use one hand to squeeze the breast and the infant swallows. Keep squeezing until the baby stops or slows down by suckling again. When you release the pressure, the baby will increase swallowing. Once you slow it down, squeeze again. Repeat squeezing and releasing. It's, by doing so, by doing so, the milk is easily flown, and the baby also can take up easily and can get the more milk, which is hind milk, which is very, very important for the nutritional development. So breast compression and switch nursing from one breast to another. So what the infant lose interest in active suckling, when we are feeding the baby, we need to first start with one breast. So when we notice when the baby is losing interest in suckling, then slip the finger in the corner of the mouth to break the suction, to open the suction, and again move over to the other breast. He should nurse more vigorously. Okay, when the suckling slows down again, switch him back. So keep repeating until the infant seems to be satisfied and fully breastfed. Okay, so by doing so, we can combine both breast compression and switch nursing, okay, so that the infant can gain adequate weight. So how do we make sure that infant is receiving adequate nutrition? So we should have at least 3 hours of bowel motions every 24 hours, okay, good skin tone, okay, and baby is following under growth chart parameters. So these are the regular consultation with the pediatrician, and by evaluating the weight and height of the baby, so we will be ensuring that baby is receiving adequate nutrition. And if there is any issue, immediate consultation with the pediatrician and lactation consultant will address these problems. So these are the lactation issues. So, and the next important considerations are dental care considerations. So what are the dental issues we commonly encounter? So mainly we encounter delayed eruption, tooth malformation, the change in the position of the teeth, the change in the number of the teeth, and the gum issues. So these are the main important issues we see in these children. So and most of the time, considering the underlying medical factors, we need to consider before we plan for the dental treatment. So what are the dental factors we had to consider? It's basically congenital heart diseases, compromised immune system. Congenital heart disease, because we need to liaise with the cardiologist to consider any antibiotic prophylaxis before we start dental treatment, and compromised immune system, and because of that we need to aggressively treat any infection by antibiotics and eliminating the foci of infection, and chronic respiratory tract infection and atlantoaxial instability. When we are positioning the baby in the chair, when we are examining, we need to make sure that we do not overextend the neck. And sensory, usually we face hearing and vision issue. So these are the main hearing and vision. These are the main problems can be addressed by the breast milk. As we discussed before, the DHA, dextrofolic acid, present in the breast milk, which is very important for the vision development. And hearing too, and repeated ear infection definitely can dampen the hearing quality. So, but breastfeeding is very, very important in addressing the ear infections, and it's very, very good. So, sensory issues and Alzheimer's condition as the in later life, we see more from Alzheimer's issue and various degrees of intellectual impairment, so which can have an effect on communication and behavioral thing. So these are the factors we keep in mind, medical related factors, before we plan for extensive dental treatment. And so what is it different about the teeth of about the teeth? What is it different? As we discussed, usually the delayed teeth, extra teeth, and missing teeth. So the milk teeth, the baby teeth come very late and they exfoliate very late. They fall off very late with the permanent teeth. On an average, with babies with Down syndrome, get their first teeth around 12 to 14 months, but maybe as late as 24 months of the age. Ideally, it is supposed to be around 6 months, but it's been delayed more than 1 to 1.5 years. It is typical that the child with Down syndrome may not get all 20 teeth when till the baby is 4 or 5 years of age. Ideally, this should be completed by 3 years. The first permanent teeth and permanent 6 molars may not erupt at 8 to 9 years. And it is also common for the children with Down syndrome to erupt in a different order. It means that they might not fall in the typical eruption order. So some teeth might come early, some teeth come later. So they do not follow typical so-called established eruption pattern. So these are the factors, and most of the time we do encounter extra teeth or small teeth and also open mouth posture with a protrusive tongue. That lips tend to be thick, dry, fissured with a poor anterior oral seal, and the maxilla and zygomatic bones are small, and mandible is protrusive in them. And because of all these facial features, most of the time children with Down syndrome are prone for sleep apnea also. So it has been reported that incidence of upper airway obstruction may be as high as 31% in children with Down syndrome. The decreased airway size combined with a lower muscle tone predisposes to obstructive sleep apnea. So if it is left untreated, undiagnosed, it can further lead to developmental delay and lead to pulmonary hypertension and heart issues also. So what are the symptoms we do encounter? Mainly snoring, restless sleep, unusual sleeping positions, and daytime hyperactivity. So some children do grind their teeth. So these are the various symptoms, and bedwetting. And so these are the various symptoms we do notice sleep apnea. And as and when we diagnose sleep apnea, it's very important for us to address this issue because it has a very important role to play for the brain development. So the child sleep is very, very important, and because it has a huge effect on the growth of the brain and also immune system. If it gets disturbed, sleep gets disturbed, so it would be very difficult for them to cope up with the additional cognitive challenges in life. Okay. And dental caries and gum diseases also, they're very prone for it. So how do we address this basic issue? Because we need to use a toothpaste which contain high fluoride. Usually the market above 12 years, we can go with 2,800 ppm, and above 16 years, we can go with the 5,000 ppm toothpaste. So we need to start brushing as soon as the first tooth erupts with a 1,000 ppm toothpaste with a very little quantity. And it has to, the brushing duration should be minimum 2 minutes 2 times daily. Okay, the toothpaste which I mentioned here, 2,800 and 5,000 are for higher, like above 16-year-old children. And what are the different toothbrushes we do? Which are very effective in removing the plaque and the calculus. So there are various designs, the electrical one, a manual one, and there are various other toothbrush models which are double-headed ones. Okay, so which are very, very effective in removing the plaque without much help of the carer. Okay, so as these are the brushes: Collins curve toothbrush, okay, Tipe interdental brushes. These are the brushes, various design, so which effectively removes the plaque. Okay, the most economical one, if the child has any issue with the holding anything, they can just hold with for the proper grip. We can make our homemade toothbrush ball, like simply adding a tennis ball or any kind of the cycle, rubber thing. So it will add up to the grip, and it will the child can brush and remove the plaque more effectively. So these are the brushing techniques. If the child is depending on the carer, so these are the brushing positions. So we need to use something like mouth rest, and we need to stand behind the child, okay, and not the child adult. So we need to open the mouth with the mouth rest and then slowly clean the teeth for 2 minutes. Okay, alternatively, if we do not have this mouth rest, we can use another toothbrush, as you can see in the second photograph, to open the mouth, to stabilize the mouth, and then brush the teeth. Okay, and in case of any gum issues, any gum related, and the teeth are erupting most of the time, we do encounter some infection or sensitivity. In such cases, we can apply chlorhexidine gel also for the proper gum care. So what are the brushing tips? Brushing twice daily and for 2 minutes, okay? And brushing should be the last thing at night, and do not eat or drink after brushing, and try to spit out the toothpaste after brushing, and do not rinse vigorously, because we want the fluoride in the toothpaste to act on the teeth for longer period of time. So so just simply spit, but do not rinse vigorously after brushing. And equally, the tongue hygiene is also very, very important, apart from the teeth and gum cleaning, because tongue holds the lot of fungi and bacteria in the throat. So it's very important. Tongue hygiene also plays a very important role in preventing the bad breath and also cavities. But regularly cleaning the tongue with the tongue cleaner will definitely. And sometimes we do encounter dry mouth, because they might be using some medication for other health issues. So this dry mouth also predisposes them to the cavities and fungal infection. So it's and also it affects the speech, swallowing, and mastication, and it does cause some kind of burning sensation in the mouth with altered taste sensation. So it's very important for us to address the dry mouth in this way. So there are various products available in the market which acts as like artificial saliva, so they help in addressing these signs and symptoms, like biotin oral basal gel, there's some sprays like Bioextra sprays. You just have to spray all over the mouth. So these are the various salivary substitutes, and simply chewing sugar-free chewing gum, and sipping the water regularly, and avoiding hot and spicy food, and avoiding hot weather. So these are the other symptomatic measures we can take to avoid the dry mouth. So what are the let's look at what are the consequences of poor oral health in general health. As we discussed, the children or adults with Down syndrome are more prone for respiratory tract infections. So when the mouth actually harbors a lot of bacteria, which most of the time does cause lung infections, especially aspiration of mouth contents, especially in the deep sleep or anyway. So it is mainly, so it's very important for us to maintain an oral hygiene, which is very, very important, especially when they are using any dentures. So dentures, if they are using it, denture care is very, very important, because denture does hold a lot of bacteria, and those bacteria are responsible for stomach as well as lung infection. So as discussed in the slide, the bacteria in the mouth causes pneumonia and bronchitis. Frequent ingestion, aspiration of the bacterial contents from the mouth to lungs leads to aspiration pneumonia, especially in individuals with difficulty swallowing due to poor motor control. And also gum diseases, and which has an effect on dementia. The current studies have proven that the bacteria and the gum bacteria which are responsible for gum diseases, okay, they does accelerate the growth of they accelerate the progression of Alzheimer's, which is dementia, loss of memory. They have stated that the bacteria will release some substances known as, okay, tumor necrosis factor, interleukins. Okay, these are the chemical messengers. Okay, when the gum is kind of inflamed, okay, those products can percolate through the gums, enter the body and reach the brain, and does cause a lot of damage, and it will progress the dementia, Alzheimer's, which will, like, loss of memory in a more faster pace. By keeping the oral hygiene in a very good way, we can definitely prevent or even herald the onset of Alzheimer's. And one more thing, diabetes control, and poor oral hygiene has been related to poor diabetic control due to the bacteria from the gums passes into the blood and causes inflammation, and which further increases the blood sugar levels. Okay, so more fluctuations in blood sugar noticed in less hygiene individuals. Okay, after restoring the gum health with the dental treatment, there was less need for the insulin, also oral medication to control blood sugar levels. As we seen, simple cleaning and polishing of the teeth in many randomized trial studies have shown that simple cleaning have reduced the blood sugar level to 0.4 micron. So what I meant was this has a both bidirectional relationship. If the sugar levels are at higher level, the patient will be prone for rapid destruction of the gum disease. The gum disease will be very rapid and they progress rapid. At the same time, the gum diseases are high, the blood sugar levels also will fluctuate. So it has a very close relationship with the oral cavity. By maintaining the oral hygiene properly, the diabetes is very well controlled, so which is very, very good sign. So as we discussed, the oral health is playing a very important role over here by affecting heart and lung diseases, Alzheimer's, stroke, diabetes, colon cancer, obesity, and premature birth in pregnant women. So early professional treatment and daily oral care at home for the people with the Down syndrome to enjoy the benefits of the healthy mouth. So it's very important for us to, educate both patients and carers about the importance of the oral health, and also about importance of the breastfeeding in overall healthy immunity and also nutrition and the bond. So it's giving a good start to the life, great start to the life, and also later when the teeth start erupting, how do we take care of them and how do we address any kind of dental related issues in the earlier stage to avoid any extensive treatment. So these are my references. Thank you. Thank you.